going to talk about children's oral health as we come towards the end of Smile Month. It's a very important topic. So we've got a guest today to talk all about this. Dr. Bani Hani, would you like to just introduce yourself? Let us know a little bit about you and your background.
Of course. So first of all, thank you very much for having me this afternoon to talk about the children oral health here. So I am Dr. Alaa Bani Hani. I am a consultant in pediatric dentistry at King's College Hospital, London. I have a PhD on caries prevention and management, especially the use of minimal intervention dentistry, which is a spectrum of a child-friendly technique that aim to manage dental decay in children without giving local anesthetic or teeth drilling. From University of Leeds, and I completed an NHR-funded clinical lectureship and specialty training in pediatric dentistry from Leeds in 2021. And in 2021, I decided with my husband to move to London, where I completed my consultant training at University College of London, Eastman, and Great Ormond Hospital. And 2023, I became a consultant and I got my job at King's College Hospital. So that's briefly who I am.
Amazing. So such a like very varied route into what you're doing now. Can you just talk to us a little bit about why it is so important for children to look after their teeth? Because I'm sure, I don't know if it's still common, but when I was younger, I think a lot of people had the attitude of, well, they fall out, so it doesn't matter if they skip brushing before they go to bed, or it doesn't matter if they have all these sweets, like they're going to fall out anyway. Is that still a thing that even like comes up or not?
Of course, yeah, we still hear that a lot from not every parents, but from some parents and from some people. They would say, "So, what do you do exactly as a pediatric dentist? Baby teeth is gonna fall out, when child is around 10 or 11 years old." However, many people don't know that baby teeth are really very important because they do guide the adult teeth to come through. And also, when children don't brush their teeth, every time they eat and drink, there will be a dental plaque accumulating around their teeth. And dental plaque has bacteria, harmful bacteria. And that bacteria produces acid and can cause gum diseases and can cause tooth decay as well. So gum diseases are not great because they can be painful, they can cause gingival recession, and tooth decay can progress to cause cavitation, and the cavitation can progress to cause pain and infection, which can impact negatively on the child and parents' quality of life. So we get to see a lot of children coming to us with extensive decay in their mouth, where they are suffering from pain, lack of sleep, even their performance at school has been affected, where they had a lot of missed school days. Parents have to take some time off to take them to see their general dental practitioner or even to a private practice, which can cause financial burden on children. And the impact does not only extend to affect the quality of life of the child and the parents, but also infection in baby teeth can affect the developing adult teeth underneath it, where we see a lot of permanent teeth coming through with white or brown spot on them. And then, when the child grow a little bit older, they're not very happy about the color or the shape of the tooth itself. But also it does affect our NHS services. So at the moment, unfortunately, dental decay is very prevalent. So in the UK, we say 1 in 4 of the 5-year-olds and 2 in 4 of the 8 years old have untreated dental decay. And every 15 minutes, there is a child who loses a tooth to teeth extraction, because by the time they go to see the dentist, dental decay is already extensive. And the only option for some of these children is to have their teeth pulled out under general anesthetic. So many teeth are losing their teeth, which can also affect their eating and drinking. And the cost, the burden of the cost on the NHS, it's just really very significant. So I'll just give you an example. In 2025, the estimated cost on dental general anesthetic for teeth extractions in children have cost NHS around 51 million pound, which is a lot of money. And that's why looking after our teeth and looking after the children's teeth is very important.
Absolutely. When you hear figures like that, it sounds almost inconceivable, I guess. Like, but then even on like the person level, if it's just one child that's having a teeth pulled under general anesthetic, and that's not a risk-free procedure. It comes with real risks to it.
So definitely, treatment under general anesthetic is considered a very stressful experience for the child and the parent. So I do general anesthetic every other Monday for the children at King's College Hospital, and I do see a lot of children coming for the treatment. Feeling very stressed about the idea of going off to sleep to have their teeth done. And I get a lot of them asking me questions about, like, for example, Dr. Ala, do you think we're going to be okay? Are we going to wake up after going to sleep to have our teeth done? And it just breaks my heart when I hear the children, how stressed they are about having their treatment done under general anesthetic. And they're having a general anesthetic to treat dental decay when dental decay is largely preventable in the first place. So I don't really think children should have general anesthetic to treat their teeth because we can easily prevent dental decay in these children. Also, parents get very stressed about sending their children off to sleep to have their teeth done. And the moment I just come out of the general anesthetic to reassure them that everything went well, I could see a lot of tears in their eyes. It's just the relief, that everything went well. So, general anesthetic does carry risk. It's a stressful experience, but also carry risk to life. And many people might just overlook that risk, but there is a genuine risk associated with giving a general anesthetic for a disease that is considered preventable.
Absolutely, yeah. Do you think that with not just with having general anaesthetic, but children's tooth decay in general, do you think it's something that has gotten worse in recent years, or is it improving? Or yeah, say in the last sort of 5, 10 years, do you think it's changing for the better or for the worst?
I think the prevalence overall got better. However, it just leveled off and stayed the same in the last couple of years. So at the moment, we say 1 in 4 of the 5 years old have untreated dental decay, and 2 in 4 of the 8 years old have untreated dental decay, which is a high prevalence for our children. So I do say that yes, dental caries is very prevalent, and the amount of untreated dental decay remains very high in the UK.
Karen, you've worked in dentistry for a long time. You've seen all sorts through our helpline. I think this is probably a really big one that would come through.
We used to get a lot of very worried parents, and often what I found as well, that parents that thought they were doing really well and looking after their children's diet hadn't looked at hidden sugars in products. Fruit smoothies, they think they're full of fruit. It's a great thing for kids to have. Cereal bars and things like that, that they think they're doing the right thing until the child goes to the dentist, either for a regular checkup or because they're in pain, and they realize that what they're giving them is actually not the best thing that they could give them for the teeth. So it's almost being trying to be good, but not knowing the right thing to do. And I think obviously education is the best way we can get through. As you say, dental decay is pretty much a preventable disease these days, with fluoride in the water and fluoride in our toothpaste and improved oral health products. And the more awareness of what causes dental decay, really.
Karen, I would like just to add one point to what you've said. What you've said is all true, and it's just brilliant. The other thing that I get sometimes parents coming to me and say, well, we're trying our best to give them healthy food. We even give them dried fruits as a snack rather than chocolate and biscuits. And many parents don't know that dry fruits have a lot of sugar in it and they're sticky. They stick to the teeth. It's very hard to brush them off. And also, I get parents coming to me saying, well, honestly, we don't buy anything that has added sugar. The juice that we give them all the time has no added sugar. And again, they're not aware of the hidden sugar and the amount of sugar that in it. Just to add to what Karen said, because it's really important. It's all about the awareness among parents of what do they really do for their children.
We have a dried fruit debate, and obviously when we look at delivering better oral health, it does say about having dried fruit as part of a mealtime, but we would say that about every fruit. And I always think if you can give somebody a whole fruit rather than drying it out or making it into a juice or a puree, that is going to be better. And trying to educate people in the art of free sugars is it's really difficult because people see the word free and they think they can have unlimited amounts of it, and it's quite difficult to get that point over, that it's only free when it's in a whole fruit. Then it's, as soon as you start messing around with it, you've turned it into, not what we're looking for, really.
I wonder as well, Ala, you've sort of addressed it a little bit, but I wonder if when you're talking to obviously your patients, which are mainly young children, what the kind of like most important messages you're trying to get across to them are when it comes to looking after their teeth. And how does that maybe change if they're like scared of the dentist or scared of like specific things like the needles and stuff, or just nervous in general? Does your approach tend to change or not?
Yeah, of course. So when I see children with untreated dental decay, they come to us, or even children with healthy mouth and they're just coming for a checkup, I would always focus on prevention of dental decay. And for the ones who have the dental decay, we're going to treat them, but we also want to prevent a new cavernous lesion. So we want to change the habits, as Karen said. So I would go and address few main points. So first of all, teeth brushing is very important. Some parents think that, okay, my child is 2, 3, 4 years old. They love brushing their teeth by themselves. Oh, okay, I'll let them do that. But they're not aware that it's really important that you supervise and you brush your child's teeth up to the age of 7 or until the child is able to tie their shoelace. Otherwise, they don't have enough manual dexterity to brush their teeth by themselves. Also, they think brushing once a day is enough. But no, it has to be twice a day. The most important time is just before going to bed. And on one more occasion, I love to advise them to brush in the morning, the first thing in the morning or even after breakfast, and then just before going to bed. That's really important. They can use either manual or electric toothbrush, but I would recommend the electric toothbrush because it does the job for you. And I know we're going to talk about it in more details in a bit. So that's the first thing. Teeth brushing is really important because you want to remove all the dental plaque around the teeth because the plaque is what causes the decay and the gum disease. Second thing, as Karen mentioned, fluoride is really important. We need fluoride in the toothpaste because fluoride does prevent from dental decay. And for every parent who are concerned about giving their child some fluoride, then I would advise in this case that they can go and speak to their dentist because their dentist can signpost them to well-trusted website where they can read about it because, the internet is just full of unverified articles and stories about how harmful fluoride is. And it's really important to signpost parents to trusted website and links and articles where they can read about the true beneficial effect of the fluoride. So we say teeth brushing using fluoridated toothpaste. And then I would say, as Karen said, limiting sweets to once a day with the main meal rather than having it a snack. So it's quantity and frequency as well is very important, and look after the hidden sugar. And the last thing I would say, start taking your child to see the dentist, ideally before the lower baby teeth start to come through. If not, then first check up at the age of 1. By taking the child to see the dentist at the age of 1, first of all, they're getting familiar with their dentist. They become less stressed and anxious about going to see the dentist when they grow a little bit older. And then if there is any issue with the teeth, the dentist can spot it early on and discuss this with the parents. So it's really important we start taking our children very early on to see the dentist and go see the dentist every 6 months. Now, if the child is a little bit anxious or stressed about going to see the dentist, there are lots of pediatric dentists who are trained to see children, and they're very trained in behavior management of these children. Even the clinic itself is very well designed for children. So we use children's language. We speak to them in a special language that they would understand. We've been trained for so many years in the NHS to treat the children, speak to them, manage them very well, so they're not scared of seeing the dentist. And also we have different ways of delivering treatment for them. So for example, we have child-friendly technique to manage decay. We can use the happy gas as well to help them accept the treatment and share. So these are my top points and advices for parents to look after their children's mouth.
It's funny you say about you use different language as well, because I obviously with the Oral Health Foundation, we follow a lot of different dentists online and different social media pages, and I often see things pop up of like what this is called and what this is called in the children's dental chair, and it's like all the different names you've got for like Elsa's wand, and rather than like a light and thing. It's just really cutesy. I really like it, and I can see how it would make it less of like a scary experience for a younger patient, especially. I would like it if I went and they were like, this is I don't know, I can't remember, think of a different example now, but they just use like really friendly language. It's lovely.
I
Yeah.
thought
We do.
you'd warm to that. That was your kind of thing.
And you know, Karen, what's the funny thing is that we really get used to it. So, for example, we see children up to the age of 16. So, last time, I think last week, I had a patient who was like 15, and I wanted to give local anesthetic. And because I'm so much used to use the children's language, I was like, okay, so now we're gonna squeeze a little bit of jungle juice around your teeth. Is that okay, sweetie? And like, no, he's 15. I can't call him sweetie. I can't tell him jungle juice. It has to be local anesthetic. It's just because we got used to it, isn't it?
I like it. It's nice.
I like it too. I think that's great.
You've touched on this as well, but the importance of using an electric toothbrush for children compared to like a standard traditional manual one. We know obviously they remove more plaque, but is there any other kind of benefits to it?
Yeah, so the electric toothbrush, it does the job simply, it does the job for you. Okay, so it would rotate, it will clean the teeth properly, it will get to the hard areas to reach, and it would remove all the dental plaque for you. So if you're not sure about the technique, or if your child, especially with children, it's hard for them to get to the very back teeth, so the electric toothbrush will do it for you. And talking about the electric toothbrushes, at the moment there are beautiful variety, and there's a lot of different type of toothbrushes, electric toothbrushes in the high street in the market, and many of them as well, they come in the funny Disney characters which children love. So for example, Oral-B just released the new electric toothbrush IO, which is for 60 plus, and it comes in two designs. So they've got the stitch design, and they've got, I think, another design as well that's designed for children. And this special toothbrush is really brilliant because we've done a study on it on 5 children, where we found that after 6 months, the basic perio exam, which measures the amount of dental plaque accumulating around the teeth, have went from visible plaque to no plaque at all, and improved gingival health for these children. So it is effective, it does work. And the nice thing about it, it's very light in weight, so children can hold it, they wouldn't get tired. It is specially designed for children who are age 6 plus, because it comes in a 3 different mood of action. So you've got the regular mood, you've got the sensitive mood, and you've got the very extra sensitive mood. So if the child have got, for example, wobbly teeth, so it's going to be effective on the adjacent teeth, but very gentle on the wobbly teeth and the gum. If the child got sensitive teeth because of certain conditions in the teeth, like molar incisor hypomolization, they can just click on the sensitive mode and they can use it because it's going to be very sensitive on their teeth. And also children with special needs or children with sensory issues, they do really like the electric toothbrush. It will do the job for them. And with that special Oral-B toothbrush, it has the very extra sensitive mode, which they can choose, which can help them as well with their sensory issues. So I love electric toothbrush, and I advocate it a lot among my patients.
Is there any kind of features that you think are like the bare minimum you need to have in a toothbrush? Like, for example, what we tend to say is as long as it has a timer, or a pressure sensor, everything else is brilliant, but they're like the basic that you should be looking for. With kids, is it slightly different? Like, I love the idea of extra sensitivity levels, especially with sensory issues. That sounds like a game changer.
Yeah, so I would say go for the one that is medium, because you don't want extra soft, because you want to remove the dental plaque, and you don't want a hard head as well. The bristles to be hard, because you don't want to also cause gum diseases. You don't want to like really hurt the gum or anything like that. So medium bristles is perfect. Small head just to fit in the patient's mouth, which Oral-B've got awesome. They've got all these features in their electric toothbrush. Also, if we can get like the one with Disney characters, so that will be very motivating for the child to use it. People, children love Disney characters, especially if they go for their favorite Disney character. Also, if they go for the one that has different moods, especially for children who are 6 plus, when they start to have their baby teeth become wobbly. So do you want as well something that can be sensitive and very gentle around the wobbly teeth? Some children, they're born with special conditions in their teeth where the teeth are very sensitive. So you also want to go for a mode that is sensitive. And if the child has sensory issue or special need, sometimes just using the regular mode can be difficult for them. So you can go and pick the very sensitive mode. So electric teeth brushes, they come in different mode. What I would say, go for the medium bristles, go for a small head. And if your child have got extra needs or anything like that, then choose the one that has the 3 modes. Otherwise, you can go for the sensitive or the regular mode if they've got wobbly teeth.
I guess the last thing we want to kind of ask you is, if what is one thing that parents could do to help encourage their children to take care of their teeth, but actually also what is your like one piece of golden advice that you would give either a parent or a child that is concerned about tooth decay or diet, as we've kind of touched on? What do you think is your golden nugget of advice?
I would say my number one advice would be take your child to see the dentist at the age of 1. Make it a habit. Let the child get used to go see the dentist, and we don't want it to become like a big event for them or stressful event. They're going to become familiar with their dentist, they will trust the dentist, and they will enjoy going see the dentist. And if there are any issues in the teeth, the dentist will spot it and will give very personalized preventive advice and things like that for the parents. So that's my top advice. My second advice would be, as a parent, try to make looking after the oral health of you, your partner, your children, as a whole family fun. Okay. And what I mean by fun, try to make it as a family activity. So why don't we all get together in the evening? We all go to the toilet and let's have fun, brush our teeth. Let's make it fun. Let's play our favorite music, my child's favorite music, which can, for example, a singer that he like, that would sing like, for example, pick a song the child likes that would, for example, would go on for 2 minutes, for example, and let's play it and let's brush our teeth. Let's make it a fun activity. If we brush our teeth, then why don't we give the child a sticker? Do you get me? It's just to try to make it like a fun family activity, whether that's through listening to favorite song or music, or maybe make an activity out of it, or maybe getting stickers, or maybe filling up like where there's a flow chart with like stickers and stuff like that. Just as much as you could, try to make it fun. Try to allocate sweets to once a day with main meal and keep having them as a snack as a treat on the weekend. Um, I think if you start with these simple habits at a young age, they're going to become part of your child's personality and they're going to stick to it. And that's my top advice.
Amazing. Well, thank you so much for joining us. It's been a really insightful conversation. I think you might be the first specialty like pediatric dentist that we've had on the podcast. It's been really valuable to learn sort of how you come at it and how you approach children's oral health. It's been really lovely, and just thank you for joining us.
My pleasure. Thank you very much.